AWP Voices, your people promise in action.
Welcome to the 5th edition of AWP Voices with me, Steve Walker, and Katie McManus. Katie will be here a bit later to tell us about the People Promise programme. Today I'm joined by Mark Earl, AWP's Safewards lead, to tell us about how we can make wards into safer places. Welcome, Mark.
Hi, Steve.
Can we begin by exploring what do we mean by safe wards?
Safewards is about mitigating for risk and conflict on the wards, and I think if we start to do that kind of work, we're making the wards a more ambient environment for people to work in and, of course, for people to access their care in as well. And wards, shouldn't feel dangerous or inherently dangerous to anybody who's accessing care on the ward. We certainly don't want people having that opinion, and by and large, I don't think that's the case, of course. So I think it's about accepting the fact that we do have challenges on wards. There's never going to be like a ward without any incidences or any challenges to us or service users as well. So I think safe wards is about working with that reality. A safe ward isn't about the absence of incidents or conflict. It's of course about how we mitigate for them and how we kind of reduce their incidents and how we ensure that we kind of follow a dialogue with service users, particularly when they're aroused and distressed.
So if you're implementing the safe wards concept, what kind of things would you be looking to do?
Okay, so it's broken down, for me anyway, it's broken down into two parts. So there's 10 interventions. 5 are what I call the practical ones because they happen in real time, they're observable, they're doable, they're quite easy to evidence. And then the other 5 are much more about how we communicate successfully with each other as professionals on the wards, and of course how we develop those trusting therapeutic relationships with service users as well. So the balance of both of those two things and all of the 10 interventions interrelate and inform each other as well. So we know that if we can develop a better rapport with a service user based on trust and an intention to work in a co-produced way, with care being something that we offer and that is accessed by a service user rather than something that we do to a service user, that's going to be informed, of course, by how we communicate effectively with them.
You do training, don't you, in safe wards and in the safe wards concept?
Yes, I do, and I really like doing it. So I often go to wards after early shift handover in the afternoon, and sometimes it's just a case of having what I think of is like a reflective practice conversation. Because I think what I found and what lots of people are sort of confirming with me these days is that lots of people know the rudiments of good care, good nursing practice, and a lot of that does connect with what safe wards essentially is. It's about the tenets of really good nursing practice, maybe activities that we've always done on wards, but perhaps that we never gave a name to. So I kind of see it as part of my role is to try and encourage people to reaffirm that yes, they are doing the safe wards interventions, even if they're not conscious of the actual name or the actual description of any particular intervention. And I think that's a really nice way to work. I think it's better to go onto a ward and highlight what people are doing well and affirm that and give them praise rather than going on and saying, well, you're not doing this, this and this. So, and then I think it just makes the whole relationship a bit easier because then I'm more able to say, well, why don't you try this intervention a little bit more, or why don't you try tweaking this and working in a slightly different way. So that's how I'd see it, as building those kind of bridges, those good relationships with wards. And I try to train in a way that's based on people knowing what they're doing in the first place.
And what sort of format does the training take?
Often it's PowerPoint, so I'll just set up my laptop or whatever, or put it through a screen. So for more kind of formal training, that's how I tend to approach it. So if people invite me to a ward team day, or I go to train some preceptor nurses or IEN nurses, then I tend to use a PowerPoint. But what I always try to encourage, rather than me sort of standing up there pontificating about safe wards, again, I like to include the audience, if you want to call it that, with their own experiences as well, because I think everybody brings some degree of experience about mental health or mental illness or good clinical practice. So again, I think it's just opening up those forums so that there is that dialogue between me and the people that I'm working with on the wards. And I think for me, again, that's a really nice way to work, because I think it just improves the overall quality of communication that we have with each other.
Because if you're a ward manager, perhaps you're at one of our hospitals in Wiltshire, perhaps at Green Lane Hospital or somewhere else, and you think, actually, I've heard about Safewards. I'm sure we're trying to create an ambient environment on the ward anyway. We're doing lots of things to involve the patient. So probably, in a lot of cases, actually, the concept of Safewards is all pervasive. It's sort of running through what you're doing.
Yeah, exactly. That's how I like to think of it. That it is a kind of a culture. It's a way of working. It offers a slightly different way of working, I think, sometimes as well. And I think it's really great if you have loads and loads of clinical experience of working on wards. And I never presume to try and teach people who are very experienced to suck eggs by trying to sell safe wards to them. It's nice to be able to, as I say, develop that dialogue, develop that quality of communication, and to have that sense of inclusiveness, I think, as well, that it will work in any environment. I think that's the nice thing about it. And, I try to encourage specific wards who have specific specialisms, perhaps, say, around later life and dementia, or the Section 136 suites, or mother and baby, or the eating disorder unit, or any ward, really, is for me to try and be flexible with them about the interventions, because some are a challenge. For example, it's difficult to do a mutual help meeting on a Section 136 suite because you don't have a community in the sense that other open wards or secure wards or specialised wards do. So I'm always open to wards being able to, again, interact, adapt the interventions, so long as they stay within the spirit of the intervention, but that it's useful to them and to their ward. Again, I think that's a great bonus that, as you say, it starts to inform the culture of the ward. And the more we do that, I think the more we raise that kind of level of awareness and consciousness, if you like, then we all start communicating better with each other, I think, too.
And of course, I was at a carers event recently, and they were talking about co-production, because of course that's becoming increasingly much more common now, across all areas really of healthcare, as clinicians are partnering with patients, aren't they, to co-produce aspects of the care pathway in a way. And again, with Safewards, that's also something that's going to help, isn't it, to create a more pleasant environment on the ward.
Exactly, yeah. I think when people have a say and they feel included and listened to as part of their care package, I think the whole experience of being cared for on a ward becomes a lot better. And the whole co-production, concept has been around for quite a few years now. But I think it's one of those concepts that hasn't come and gone. It kind of stands on its own 2 feet because it's a great definition about how care is that thing that's accessed, that it's mutual. There's give and take in it. There's a it implies a relationship or a therapeutic relationship. That can only be a good thing.
And do we have any real examples of how Safewards have really helped lift the environment on the wards to the benefit of some of our service users?
Well, I had, going back a couple of years, I came across a nurse who was working in the low security unit, Wickham at Blackberry Hill. And he'd been away for some time from working on the ward, and he came back and he expressed this to me. He said, I came back and there was just a change, and it was hard to put his finger on what it was. But he said, well, I think one of the reasons may have been that Safewards has been taken up. So that was nice for me to think that it had kind of changed things a little bit for those 3 wards in low secure at Blackberry Hill. So that's a celebration. But I think there are other kind of bits of validation that I've had over the past couple of years, probably, where I do trauma-informed care training every couple of months with one of the psychologists. And she fed back to me that, look, you don't need to sell Safewards anymore at these events because people know it. People are aware of it, even if they not have a deep understanding perhaps of the interventions. But people know it. It's on their radar. People are aware of it. And we're having like this a monthly Safewards Day for Bristol services now as well. So I think for sure, I think there's been a bit of a turning of a corner in terms of people's awareness of it, people finding it useful even as well.
So if people want to find Safewards resources or just find out some more information about how they can implement the concepts, what's the best thing to do?
Well, get in touch with me. There's also the website is out there as well, so that's safewards.net. Lots and lots of detailed information on there. There should be posters and things around the wards as well, visual stuff, that's kind of things. I like doing that as well. So, there are lots of ways that people can learn about Safe Wards these days. They can come to me, I can do coaching one-to-one even sometimes. I did that last week, and that was really nice. So, first point of call, contact me.
And do you have a sort of program you're working through of awareness or training sessions or activities to, although we've talked about perhaps you don't need to sell Safe Wards so aggressively now because it's out there, do you have still a program that you're working through to help make people aware of what's on offer?
Yeah, I think so. For a long time, pre-COVID, we were doing forums. They were always quite well attended and really, really enjoyable. And again, I found that a nice way to work with people because, in a sense, I suppose anybody who agrees to come to a Safe Wards forum is interested anyway. So that's always nice. But I did one back in September, first one, proper one, in 3 years, I believe. So yes, that was really enjoyable. We didn't get through the whole agenda, which again was because we were having good dialogue and good conversation in the room as well. So yes, that kind of thing really works for me, I think, anyway. Co-produced, perhaps sense of working between colleagues as well. That happens in that environment, I think.
Is there information available on our space as well?
Yes, there is. Yeah, there's a Safe Wards page there, lots of content in there, some documents and visual posters and things. Of late, I've also developed things like posters as well with comms, so those should be around all the wards now. I've got some nice leaflets that I had created for service users. It's a nice kind of easy read version for service users to browse and understand a little bit about what Safe Wards offers them. And I'm currently running my annual service users survey. So that gives me a bit of feedback about whether service users are aware of Safe Wards themselves. Because I think if we start hearing service users talking about Safe Wards, then I think we know that things really have changed as well.
If you start getting some good feedback from service users, such as words to the effect that they felt safe on the ward, they felt engaged, they felt their treatment was, they could talk to the doctors, they could talk to the clinicians about their treatment and their pathway through, then it feels more like it's being done with them than to them, and it's more like a partnership.
Very much, yeah. But I think it's a very democratic way to work. It's a great way to listen to people who are actually on wards being treated, what their experiences are like. You don't always get good feedback from them, but that's their work, that's their reality, that's what they're feeding back to us, and I think we need to listen to that and try and respond to that as well. So,
because you mentioned as well you're having a Safe Wards Day for Bristol. So what kind of format is that going to take?
Again, it was very dialogue based. The first one we did at the beginning of October. Yeah, I couldn't have wished for a more enjoyable day. I think we had 10 people representing the Bristol wards. And it was about them and what they wanted and what they were doing and what they wanted to develop. And again, I think that's a nice negotiable way to work with people, because then you're not having to give the hard sell. They're kind of, they're doing that themselves.
And based on the success of the Bristol Safe Wards Day, are you going to roll one out for Wiltshire as well?
Well, there's a thought. That would be nice. Yeah.
So if people want to get in touch with you, Mark, about Safe Wards, perhaps they just want to have a chat about it, perhaps they want to think about just exploring the concept with you, what's the best way to contact you?
Oh, probably by my email address. So, yeah.
Which is?
mark.earl1@nhs.net.
mark.earl1@nhs.net. Mark, thank you.
Thank you very much, Steve.
Katie McManus is standing by to join the conversation. So welcome, Katie.
Hello, Mark. Thank you ever so much for doing the podcast with us. It's really interesting to hear about that area of work. And the people promise that we're thinking about today really is we are safe and healthy. And we know that our staff work in a huge variety of roles in all sorts of different areas of the trust. And it really sounds as if the Safe Wards work is doing a lot to help the working environment be more safe and healthy for our staff. Am I right in thinking so?
I certainly hope so. Anyway, I mean, if it's not, then either the title's wrong or something else is wrong, isn't it? Safe Wards, it kind of says what it does on the tin, kind of, really. But I think, I see a lot of wards, and I see that as kind of a privilege in a way. I get to see wards kind of as they really are, and I take away those impressions, and And I do notice, particularly on the open acute wards, that people seem to be significantly more unwell than in my experience over the past 20, 30 odd years of being a mental health service user. So inevitably, I think a lot of wards are facing a lot of challenges around that, how they're working with those levels of acuity to try and keep everybody feeling safe. So I'm hoping that Safewards is one of those kind of agendas, or one of those cultures, if you like, that hasn't gone away. Been doing the job for 9.5 years. So that says something, I think, about the nature of the wards themselves. I think their kind of willingness to want to try and change their practices a little bit, and finding that working in a Safewards informed way is actually very, very useful.
Absolutely. And I suppose underpinning everything to do with this and all of the people promises is about trying to put our people at the heart of our decision making and the work that we're doing, and realising that the work that a lot of our staff do can be very emotionally distressing, it can be exhausting, but knowing that not just AWP, but the whole industry, if you like, are really trying to work towards making things better for our staff.
Sure.
It's got to be win-win, surely.
Yeah, I think so. And I think for me as well, what does really working in mental health boil down to? I think it boils down to being a caring and empathetic person. But for me, the other baseline is the quality of our communication as well, verbal and non-verbal too, and how we're able to draw on those skills and those resources. And I think quality of communication, again, for me, is everything, So if you're talking about how we talk about service users at handover and using positive words to frame or reframe what's gone on for them during the shift, means that we're working in a way that is focused on the individual, on the service user, and that we try and hold that hope and patience and tolerance towards them, I think, as well.
And using that respectful language and positively framing things as well, it creates a better environment for the people that are there, doing those handovers and talking about the people whose lives they're having an impact on.
Yeah.
So
very much, yeah.
Thank you. Well, it's been really interesting to listen and to learn more about that area of work. And thanks so much.
Very welcome. Thank you.
Thank you for listening, and we'll see you again soon. For now, take care.